Okay, good afternoon, and welcome to today's webinar about 5 important questions to answer when paying for the care you or your loved one may need. My name is Juliana Valencia, and I am a caregiver specialist with the Fairfax Area Agency on Aging. You should have received an email this morning with the speaker's slides, so you'll have them for future reference. It's not necessary to have those open because we'll be able to see them as the speaker presents. You can ask a question at any time during today's presentation by typing it into the question box on your panel. Today's presentation is being recorded, and a recording will be sent to all registrants by early next week. There will also be a brief survey as you sign out, so please help us by giving us your feedback. Now it is my pleasure to introduce today's speaker, Tom West. Tom is the creator of Life Care Affordability Plan and a partner in Signature Estate and Investment Advisors, an investment management and financial planning firm that emphasizes cash flow in all stages of retirement. Over a 25-year career, Tom and his team serve families struggling with how to support a loved one diagnosed with a chronic illness, disability, or dementia. In 2018, with a fiduciary grade standard of care, Tom launched the Life Care Affordability Plan, which is a fixed fee financial planning and asset management solution designed to provide families with a financial strategies that meets changing healthcare needs while preserving the caregiver's quality of life. Tom is going to share his knowledge with us today. So Tom, take it away.
Thank you, Juliana, and thank you for the introduction. I was remarking with Juliana and Lucy Gerland, who had helped put these presentations together for the last 10 and 15 years, that this presentation that you're about to see has gone through a lot of evolutions, and we're pretty proud of the way that a lot of the information is designed to be able to help caregivers and their families. Just so you have a sense, the reason that we zeroed in on 5 important questions, as a professional, I've been providing this kind of advice and programming through Fairfax County and other places. And what I've learned is families a lot of time have unique enough circumstances that it's more important to make sure that they have the right questions to ask for themselves as compared to trying to figure out the signal through the noise of all of the information that's going to be provided. So let me give you a little bit of a sense. I wanted to start with having some framing on the very difficult environment that seniors face when they're trying to make some decisions about how to pay for care for a chronic illness for a loved one. There's sometimes uncertainty about the cost and availability of appropriate care. There's uncertainty sometimes about what exactly Medicare and Medicare Advantage covers as it relates to help for chronic illness payment. There's certainly uncertain financial markets and real estate markets. A lot of times seniors need to go into their investments or their home equity to be able to pay for care, and the value of that, as we know, sometimes changes. And there's always the specter of elder financial abuse in the middle of dealing with a chronic illness. Certainly something that we see a lot with dementia or cognitive impairment is how do seniors and their families make sure that they're appropriately protected while they're trying to make decisions about how to pay for care. There's also a lot of changes that go on at the household level. This is beyond the environment. This is just sort of what's happening in everybody's individual household. Family dynamics, you can see here, well, that sometimes changes. If you have, a parent-child relationship that needs to change with different family members having to make some decisions for somebody that's less able, that changes a lot of the dynamics and the way that families communicate. Also under my check marks here, like how do people make decisions from an authority standpoint? Are different family members or professionals willing, or are they competent to be able to help assist seniors in making decisions? Certainly, a lot of times families have to react to the healthcare events themselves. Are there challenges with dementia, complicated care? Is there a medical event that's caused changes in mobility that might impact the suitable setting that somebody needs to stay in? And then lastly, their personal financial situation. Are there changes in their assets or their income that they need to pay attention to? I give you all of this, and the graphic that we sort of designed is I wanted to demonstrate for our audience that it's really a challenge, that this disjointed way that families have to look at an uncertain environment and then all the changes that are going on the household level can make for some really confusing and challenging circumstances to make effective decisions. So what we're trying to do with this presentation is what are better ways to understand all of the different elements of effective decision making around financing, paying for long-term care. We're hoping that this particular presentation helps answer a lot of those questions. So let me start with, I think, something that's a little bit less complicated. Most of the time when families think of financial planning or retirement planning, and professionals as well, they usually think of it along a lifetime, where people have to make some financial decisions before they retire. Things like, am I putting a kid through college? Am I paying for a house? There's a distinct chapter after people retire where they need to move away from earning income at a job and maybe relying on pensions or Social Security or supplements from their investments to be able to cover their standard of living. And from a planning standpoint, when I put legacy here on the tail end of the line, well, after somebody passes away, how is an estate set up for survivors to be able to potentially benefit from an estate? This is a typical financial planning timeline in the way that a lot of people think of things in terms of planning ahead. And what I wanted to share with the audience today is that that really isn't exactly how a lot of the timelines go for families facing caregiving. Sometimes it looks a little bit more like this. And I want to walk you through this particular slide. What I put in the middle here is when healthcare stuff happens, when there's a change in health or a change in ability, a cognitive impairment, a fall, something where we now have to change around the job of the money. We have to look at the way our income and our assets serve the senior to be able to pay not just for standard of living, but also for the cost of care. A lot of times families, if you see down on the bottom, move from planning ahead to reacting to the new circumstance. And for many seniors and their families, they haven't had a whole lot of practice on doing a lot of financial planning in a reactive mode, where they're not in control all the time of all of the different circumstances that are being forced on them. So compounding this problem is you've got two different professional, and we call them tribes. I think financial professionals, sort of the industry that I'm coming from, financial professionals might not fully understand or might not fully recognize all the challenges associated with senior housing, whether it's housing where somebody is right now in their home or transitions. They might not understand all of the different challenges of healthcare, and that's a challenge. At the same time, professionals in the senior housing and healthcare industry, they might not speak or fully understand personal finances. They might not know what the best way to plan for liquidity or how to think of withdrawals from a retirement account. And families are caught in the middle. And these two different industries, the caregiving industry and the financial services industry, not always being on the same page, it puts families in sometimes an untenable situation, because on top of everything else, they've got to translate to these two different groups of professionals back and forth what the respective needs might be. And again, everything a lot of times for families is moving into a reactive situation. So again, a big challenge. When the healthcare stuff happens, families typically look to senior housing and healthcare professionals, or professionals like Juliana and Lucy at the Area Agency on Aging, just for advice or resources or direction about when is it appropriate to stay at home versus considering a move to a community or a facility. A lot of times these professionals have to give guidance about whether care needs to be skilled, where that's going to be something that has a higher standard of medical care, or not skilled, like personal care with activities of daily living. Families interact with these professionals to determine whether we're treating a particular disease or we're moving into comfort care. And then lastly, being able to guide families through all of the myriad of different care options. Think of different facilities that have independent living options versus assisted living options versus nursing home. Just the menu of different services out there can sometimes be paralyzing to families. The other piece too that we have to pay attention to, this was certainly the case with my family. My wife and I took care of my in-laws, for a period of about 4 years. What I experienced as a family member, not just a professional, is how challenging it is to make financial plans paying for care when you don't know how long somebody's going to live and you're not quite sure how much help they might need in the future. And let's all recognize that there's a tendency to procrastinate until better information or more information presents itself. For families that don't do things like this professionally, that they don't have a lot of practice, living through a period of care, I think that it's very sympathetic to want to wait for better information to make sure that you're doing the right thing. But what we're going to talk about today is that tendency to procrastinate sometimes can put families at more financial risk than they might expect. So I want you to think about this. A lot of reasons that people hesitate is fear and uncertainty about what's coming. And there's certainly one of the things that we've gone through just in the first 5-10 minutes of our program today is the complexity of all of the different elements of a good plan to help finance a chronic illness. It makes hesitation sort of natural. And I want everybody in the audience that is a caregiver, I want you to think if these kinds of things that are objections to making choices sound familiar. Sometimes families who say, listen, I don't know what I want to do. I don't know if I want to stay home or I want to move or I want to move in with a kid. Other objections to making choices is maybe there's a medical event, but somebody's recovered and things are better now. So it feels like I'm not as urgent to make a decision now, even though maybe on some level I feel a little bit more vulnerable and know that a time's coming where a choice is going to be forced on me. And then there's the price objection. Listen, I've heard that long-term care is really expensive to go out of pocket. And before even looking into it, I don't think I can afford it. So that's going to cause me to hesitate moving forward. A lot of the rest of the presentation today is to give some guidance on how families can digest each of these objections so that they can make the appropriate choices to take care of their loved one, at the right time. So one of the things that I thought would help would be identifying what a lot of families don't realize, where they don't realize that sometimes right before a healthcare event, that there's a chapter in this timeline where options are taken away, and families don't necessarily realize that options are taken away. So and I'll give you an example. Sometimes when people are considering moving into a community that has independent living and assisted living and nursing, think in Fairfax County like Green Spring Village or Goodwin House. If people have changes in their health, it might not be appropriate for people to move into a community like that because they might not have the health profile that fits for a new entrant. So sometimes people want to wait until something goes terribly wrong with their health before they're very sure that it's time to move. A lot of times families get surprised that some options are not available anymore. So I wanted to sort of give you that as sort of a takeaway before getting into the 5 questions proper. make sure that you know where your situation is right now, and we'll talk a little bit about knowing what the set of choices are that families have at any given point in this process. So now what I'm going to do is I'm going to talk about the 5 questions, critical considerations that affect care. And what I'd like the audience to think of, and if you're going to be taking notes on anything, I make a point of saying, take a note on each of these 5 questions. And what I'd like you to think of is, make sure that you get the answers to the questions that are right for you, that are right for your family member, a particular diagnosis, what the prescribed plan of care is, because everybody that's watching is going to have a little bit of a different circumstance. And I've gotten a lot of good reviews on audiences being grateful for me posing this as a handful of questions. And then at the tail end of the presentation, I'll do my best to give you great approaches to getting answers to those questions. But question number 1, do you know how much long-term care is going to cost? And one of the, I'll leave this up on the screen just to make sure everybody can have a notation of it. Do you know how much out-of-pocket cost this is going to end up being? I mention this because there's a lot of research that says even people on the front end of a period of care, they really don't know what the cost might look like. You can see from these statistics up here, many people are way off in terms of what the long-term care might actually cost. And just look at assisted living facilities. Only about 30% of people estimate accurately what assisted living or sometimes memory support might actually cost. That means 70% of everybody out there doesn't really understand what exactly it's going to cost. And my advice when you're pursuing the answer to this question, do you know how much long-term care is going to cost? I want to make sure that you account for changes in health. Just because if you move into an assisted living facility at a level 1 memory support, for example, that doesn't mean that that cost necessarily is going to be the same all the way through a period of care. Make sure that you do your homework on what is the initial cost for the prescribed care, and then based on what's likely to be prescribed for my family member, what could the costs change to? I think just having that information is going to be critical. If you don't know what it's going to cost, then it's very difficult to align your finances to determine what the job of the money really looks like. So the next question that I've got for us is, are you aware of what expenses Medicare and Medicaid really cover? Now, each of these different programs is a little bit different. Both of them are federal programs, and let's talk first about Medicare. Medicare, broadly speaking, is an entitlement program from the federal government that basically picks up hospital bills and doctor bills. And what I put up here, just so you can see for 2020, what estimates are in terms of where Medicare really gets spent. You can see doctor, hospital, a tiny bit of nursing facility, and then some prescription drug benefits, that being the overwhelming amount. You can see managed care under the Medicare Advantage program covering a significant portion, but again, that's just basically hospital and doctor bills. What I'd like you to notice here is there really isn't any long-term care spending anywhere picked up by Medicare. There is some very limited support for skilled nursing facility or home care after a hospital stay, but this is really what Medicare doesn't cover, just to make sure that we're being thorough. Any skilled nursing post a 3-day hospital stay, any more than 100 days, which is about 3 months, Medicare doesn't have any coverage for that at all. Home health services beyond a very narrowly defined episode, Medicare doesn't pick up home care beyond that. Medicare doesn't pick up personal care services, assisted living, dental eyeglasses, and you can read the rest. But the big message is you can't count on Medicare to be doing the heavy lifting for your particular cost of care. So question number 2, making sure you understand what Medicare does and doesn't cover. Medicare in particular doesn't cover a lot of the long-term care bills. For Medicaid eligibility, one thing that's a little bit different about Medicare and Medicaid, Medicaid is basically a federally funded program that is administered on a state-by-state basis. So we're in Fairfax County. We'll talk a little bit about the state of Virginia. But basically, there are three different eligibility factors for you to qualify or your loved one to qualify for Medicaid in the state of Virginia. In a nutshell, you have to be able to show that from a medical standpoint that you're ill enough that you need enough assistance for Medicaid to be able to pick up. So it does absolutely exist that people might have some health problems, but the health problems might not be severe enough for Medicaid to be reimbursing for healthcare costs. But most families in Fairfax County, and hopefully the people that are listening here today, understand Medicaid to be a program designed for people that really don't have a lot in terms of income or financial resources. So for an individual to qualify for Medicaid in Virginia, you have to have a net worth, a resource, a balance sheet of just a few $1,000s as a total amount before you're even financially eligible. And you would need to have income that doesn't fully cover the cost of care. There's also, you want to account in Medicaid, what if somebody's married? Can one spouse be eligible for Medicaid if they're ill enough, even though the other spouse might not? And the answer is yes. We could spend a lot of time on Medicaid. This isn't a Medicaid program. There's going to be other resources that our caregiver symposium has for Medicaid. But for that question about a spouse, in the year 2020, a non-Medicaid spouse would be able to keep in the state of Virginia a house as long as it's worth a little bit less than $600,000 and approximately a maximum of about $130,000 worth of assets like bank accounts or investment accounts. Pretty much anything past that would need to be spent, typically on the Medicaid eligible spouse's care first before Medicaid would pick up. We'll be able to field a question or two on that as we go, but for most families that are thinking about Medicaid picking up cost of care when they do have some financial resources, that's usually not the first payer, which is why I think that this next question is particularly important. Question number
Tom,
3. Yes.
sorry, we have a question from the audience. So one of the participants is asking, can you, just give me one second. I have seen lawyers advertise that they can help a person qualify for Medicaid and preserve their money. Is that legitimate?
Well, that's a great question. And there are lawyers that advertise, and in Fairfax County, there's a number of different legal businesses that are set up this way. So the answer to the question is attorneys that specialize in elder law sometimes have tools at their disposal that really zero in on something. In the state of Virginia, you're not able to give your money away easily to make yourself more poor on paper and qualify for Medicaid. There is a rule in the state of Virginia called the 5-year look-back rule. So for everybody in your mind's eye, imagine that if you give your kids a bunch of money and it's within the last 5 years, that money that you gifted to the children is considered part of what is your eligible resource, which means Medicaid doesn't think, the state of Virginia isn't going to think that they have to pay for your care unless that gift basically gets recaptured and spent first. So the attorneys that advertise for that, they have different type of planning techniques that work around this 5-year look-back rule. But generally speaking, what it involves is taking money out of your estate and putting it either with a kid or a trust for a period of time to make yourself poor on paper, and then navigate a 5-year period of time from that transfer so that you're meeting that requirement. I think that my comment on whether it's legitimate or not, I've worked with a lot of these attorneys and I know the rules. I would say two things. First off, most families, if given the choice, would want to have more control over who's providing the care. Remember that an overwhelming majority of care providers in Fairfax County don't take Medicaid. Medicaid pays long-term care service providers less than what people are paying out of pocket. So there isn't an incentive a lot of times in the caregiving industry to maximize the amount of people that are paying Medicaid because it's less profitable for them. Part of the way that I've set this presentation up, Juliana, and thank you for the question to the audience member, is before you do anything with Medicaid planning with an attorney or whatnot, I think that you really need to look carefully at how far can you pay for yourself? What are the best things I can do with the income and the assets that I've already got? And really measure that before you irrevocably make a decision to give money away and try to force eligibility on an entitlement program like Medicaid, because it's kind of a one-way decision. Once you go that way, you can't sort of take a different direction. There's not a lot of flexibility in a lot of Medicaid planning. So thank you for that. It's a challenging question, and it's part of what's confusing. Leading into the next slide that I have here, do you have a plan to pay for the outcome that you're most hopeful for? And the bridge between the audience member question and this slide up here is, before thinking about qualifying for Medicaid, why don't you start with figuring out, well, how is it that I can best pay for what the care is that's most appropriate, and then decide if you want to do something different or not. My only caution with Medicaid planning is doing things irrevocably where you can't change your mind and doing it too soon. You know, a lot of families sometimes can do things that can prolong their ability to pay for care and conserve legacy and retirement plans without having to go down the Medicaid path. And that's what we're going to talk about for the rest of the presentation. So thank you for the question. It was well timed. Let's stare at this question that I've put to the audience and just stare at it for a second. Do you have a plan to pay for the outcome that you're most hopeful for? And there's two things that I want to sort of zero in on. The outcome, you know, what is the outcome that you're most hopeful for? A lot of times it sounds like when you talk to different families, well, I want to stay at home, or I want to stay with my spouse no matter what, or I want to conserve my legacy no matter what, or a whole bunch of different things. It's very important to identify what are the different kinds of things that you're hopeful for now that you're on the front end of a period of care and thinking about a different diagnosis. And what I have up here, the most frequent responses whenever I ask people, which is part of the reason I'm asking you as an audience, I want you to think about this. What's the option that you're most hopeful for? I don't know, I'm not sure. Like, well, this is what I'm prompting you. Think carefully and write it down. What, based on your family situation, are you most hopeful for from this point forward? And then figure out if that involves going out of pocket with paying for things, know exactly what it's going to cost. But you start with what's the priority for you and what's your goal given right now. I think it's important to remember that for a lot of families, you know, their goals are changing. And this is something that from a psychological standpoint just makes it more challenging to make effective decisions, where when you have changing goals, like what are the most important things now based on your current circumstances? Well, maybe there's a circumstance where somebody's had a stroke or is recovering from cancer. And I have up on the slide here, I'm most hopeful for a cure. I'm most hopeful to get back to my previous level of independence. Well, that might be different from a financial standpoint for maybe somebody with dementia or cognitive impairment. Maybe the goal is, I want to stay at home for as long as possible, and I want to maintain as much function for as long as possible. That might be different than my third one. Maybe we're talking about somebody that has been given news that they might not have a lot of time left to live. And maybe I'm most hopeful for, from a very personal standpoint, managing the individual and managing their family for a comfortable and dignified death. I think that the idea of understanding what you're most hopeful for and knowing that that might be a different goal than what you had in a previous chapter of your life, that is really fundamental in being able to make effective decisions. I think on the next slide, question 4, I want you to stare at this question for a second. Do you have a plan to pay for the outcome you're most fearful of? And I always start with, remember question 3 was the outcome you're most hopeful for? I think it's important to zero in on what options are the most hopeful for and vet that first before thinking about how are you going to pay for stuff that you're most afraid of. I'm afraid of running out of money. I'm afraid of not leaving enough assets or income for a surviving spouse, or I'm worried that the care is going to be real expensive and I'm not going to be leaving a legacy. So what I'm trying to do with these questions for you is to create some boundaries. I want to have an approach to the things that I'm most hopeful for, which might compel me to act and not hesitate. And I also want to address directly, what are the things that we're most afraid of? Losing independence, those sorts of things. How are we going to be coming up with a financial strategy for that circumstance? Remember also that decline that sometimes costs money can happen gradually. And we're thinking of things that we're most afraid of. Remember, it might not happen all at once. It might be over time. And that's why I wanted to remind everybody that options might be taken away along the life. The last question that I have is, given all of that, do you now have a new plan that you've adjusted to pay for the new retirement and legacy goals? A lot of times when families and seniors think of their retirement plan or their estate plan, and they've thought sometimes very generously about what they might be leaving for kids and grandkids or friends or charities, they didn't account for the potential risk of paying a lot out of pocket for care. I think that it's important to make sure that you give justice to those previous goals that you had, but then work them in. How do we finance a good retirement and a standard of living and legacy goals given a new health circumstance where I'm not as much in control? And we'll talk about that in a few slides about what are practical ways to do that. But remember that the impact, long-term care physically and cognitively tends to impact one family member, but the financial impact can, be felt across an entire family or sometimes across generations, which is part of the reason that I want to make sure that we don't forget all of the goals and priorities that we had prior to a period of care. We want to integrate all that together. So with that, I think from a prescriptive standpoint, from our time today, the next 15 or 20 minutes, I think are going to be really helpful. So where is it that you start? Remember where we've gone so far. In the beginning of our presentation, we talked about the environment that seniors are in, all of the challenges around decision making, and how the typical financial framework where people are making decisions over the course of their lives is very different once we have to react to a change in care. We also talked about what the 5 questions were that I want everybody to write down and develop answers for yourself. Those questions, once more from the top: do you know how much it's going to cost? Do you know what Medicare and Medicaid cover for you? Do you have a plan to pay for your most helpful outcomes? Do you have a plan to pay for the outcomes that you're most afraid of? And then lastly, do you have a plan to pay for all the stuff that you were hoping to do before this period of care? With all that rolled up, where do you start? Well, I would start with saying a plan is something that's written down. If you don't have it written down, I would just tell you as a professional, it's not really a plan. It's a discussion point, it's a conversation that you've had, but a written down plan is something that you can share with loved ones, that is understandable without translation, and sort of documents what you're trying to accomplish. Please, everybody, take the time of writing down not just the answers to those questions that are appropriate for you, but how you're going to try to take a crack at solving this. Whether you work with a professional or not, writing it down is so important. And remember, making a plan is a choice. You can choose whether or not to make a plan or not. And the slide up here that's important: those who choose not to plan are often going to have their long-term care choices made based on the circumstances that you're in. So you're going to have a choice forced on you or not. And I use this as an example. If you go to the hospital, let's say Inova, the big hospital in Fairfax County, because of a medical event, and it's time for you to be discharged. Let's say that you've done no planning at all. You don't know about staying at home. You don't know about going to an assisted living facility or a rehab facility. You don't know any of it. If you're not able enough to live independently, and you've made no plan, you still get discharged from the hospital. You still go somewhere. There's an entire apparatus that the hospitals have with care providers where you're going to end up somewhere if you're not able to take care of yourself, regardless of whether or not you've had a plan. I want you to think of that example all the way through my sets of questions. Making plan is a choice, and remember, there's a default set of choices that are already built here in Northern Virginia for folks that don't put any attention on this. And a lot of times, those aren't the choices that families would make for themselves. So, how do you actually think of a plan in terms of a process? Well, most different disciplines, whether it's financial planning or medicine or law, they have a very similar process to go about making good decisions. And it usually looks like this. Before you jump in to any discussion about your choices, why don't you stop and organize all your information? Go back to the 5 questions that I had. Do you know how much your care is going to cost? Do you have a plan for what particular options you're most hopeful for, et cetera? Organize all your information first. Try not to jump into a choice before my step number 2. Evaluate all the different choices that you've got. If you are discharged from a hospital, maybe one of the choices is you might be able to stay at home with a family member or informal care. Maybe that's one of the choices you identify, but maybe there's another choice where you make a transition away from that home. And what are the different, for example, assisted living facilities that might make sense? I'll give you just, while I'm on dementia for a second, a very underutilized option for families facing a dementia diagnosis for a senior is adult daycare, where people are able to stay in their own home at night, but go somewhere during the day for some supervised activities and whatnot. Certainly circle back with Fairfax County and the resources at the Area Agency on Aging to get a look at providers in Fairfax County. I just mentioned that because I know it's a choice that a lot of people don't identify. I have up here on the next step, formalizing a plan. Well, formalizing a plan is basically being very intentional on which of those choices that you decide on. Executing on that and monitoring how well things are going. This is the planning process. And part of what I do for my clients with my team is we go through this rotation every single time. And I think that it makes for more grounded plans. Simple questions can be a starting point. You see me embedding this in some of my earlier slides. What am I most hopeful for? What am I most fearful of? Surround yourself with a well-balanced team of professionals who work well together. And I certainly would integrate legal and clinical and financial as much as possible. And what I thought I would do for our time remaining, Juliana, probably for the next few slides, let me get through the financial slides first before fielding questions, because I'm thinking a few of these slides are going to beg some questions, and they'll take questions at the end from these next few slides. I want to make sure that we get all of the appropriate information out in our time remaining. Just so you have a sense, one of the things that we do in my practice, we have a program called Life Care Affordability Planning that basically works through this integration of healthcare and financial. And I'm going to tell you basically if folks want to do it themselves or they want to do it with their existing advisors, let me just tell you what best practices really are. I've had the opportunity to write up these best practices in the Journal of Financial Planning 2 or 3 times in the last year or 2. So these are all peer-reviewed standards on what you do to make sure you get the answer right on how you pay for all this stuff. The first step is you gather all your documents, wills, trusts, all your statements, tax returns, and basically any of the other information about appropriate professionals, what cash flow looks like, what income and what expense might be. This is where you start answering your question about, do you know how much care is going to cost? Some families in Northern Virginia have long-term care insurance contracts or life insurance contracts that might be usable for paying for long-term care. And again, understand, what do we have to go out of pocket for projected costs of care on my bottom right? That's going to be something that's important. Part of what you want to do for financial considerations is, I like all of our families to know in advance, 6 to 12 months in advance, to know where they're going to be able to pay for whatever these out-of-pocket costs might be. I always like to have those kinds of reserves on hand, just so if people have money in the stock market, for example, we don't unnecessarily have to sell a bunch of stocks in a dip in the market. I always like to have a pretty conservative liquid amount in bank accounts or money markets or CDs that would cover at least 6 to 12 months in advance of what that out-of-pocket cost might look like. From an investment standpoint, I would think that it's very important to think, what strategy makes the most sense to support the new job of the money? And I'll give you an example on what job of the money looks like. Maybe the new job of the money, if people are going out of pocket $10,000, $12,000 a month for the cost of care, perhaps the new job of money is to make sure that there's an extra $7,000 a month on top of pension and Social Security that is coming in on a regular basis. Arrange all of your investments, I would think, to be able to support this new job of money. Don't leave it like it was before, because it's just sometimes too critical to be able, the need is critical enough that being able to reposition to support this new job of money makes a lot of sense. Consolidating and simplifying is something that I think all families need to consider, particularly if some of the decision making is shared. If you've got a spouse that is now in a decision making role that wasn't in a financial decision making role before, or adult children that are coming into the conversation for the first time, I think that it's really important to ask the question, does it make sense to have money in a whole bunch of different places? And look for opportunities to simplify. Because remember, you're making decisions not just on the financial side of things, but also on the healthcare side of things at the same time. So what professionals do, I will share with you, is we consolidate and we simplify, and then we orient any of the investments to support whatever the new job or the new requirement of the cost of care might be. This next slide is important. Taxes. One of the things that's true, even after the tax reform of the last few years ago, is for people paying out of pocket for a lot of long-term care costs, you still can deduct on your income taxes a pretty significant predictable amount of long-term care expenses past now a higher standard deduction. I have on this first bullet, how much has already been spent on deductible expenses? We're giving this presentation right now to you in February, but when I gave this presentation in November of last year, I want to add up how much have we spent already, because it will help me as a professional give advice on my second thing. Maybe you've got money in an IRA and you've already taken required minimum distributions. I want to ask the question, should we take money out of the IRA even faster than that, because we've got enough deductions with our healthcare expenses to be able to distribute money from the IRA and not pay additional taxes after you do your return? Those are things that are going to be real important to remember. And I'm just mentioning this towards the tail end of a webinar. If you're going to be putting, this is for audience members, just a note is, remember taxes, put that as a note and make sure that you're working on these particular items. How much it's been spent on deductions? Do you owe any taxes to begin with? The last bullet here I think is real important. Should tax withholding amount be changed? If you're paying a lot of out-of-pocket money for long-term care expenses, and that's going to give you sufficient deductions that you're not going to owe any income taxes, then it's really important to go back with Social Security or with your pension and take out any tax withholding. There's no point in withholding for taxes that you don't owe. This is not the time to wait for every April to get a refund. You want to have as much cash on hand coming in as possible. So a lot of times people forget, is the tax withholding appropriate that you've got given this new care cost? I get a lot of questions about using existing long-term care insurance policies or life insurance policies. And the answer is certainly for long-term care insurance, the answer is overwhelmingly yes. Use your long-term care insurance policy as soon as you possibly can. Have an understanding of what the benefit triggers are. Typically, the benefit triggers for long-term care insurance, it usually is if you need help 50% of the time or more with at least 2 of 6 activities of daily living. That's eating, dressing, toileting, transferring from bed to chair, maintaining continence. If you need help at least 50% of the time with 2 of those 6, that's sufficient to qualify for benefits. Similarly, a lot of the long-term care insurance policies will allow for benefits to be paid if you've got a cognitive impairment, even if you're able to do all of those daily activities yourself. So in 25 years, I have never come across a case where it makes sense to delay taking long-term care insurance benefits when people are eligible for them. Because if somebody dies, it's not like you can use any of the benefits in arrears. It's sort of a use it or lose it type of thing. The last point that I have here on life insurance, sometimes life insurance contracts have either cash value that is in a policy, or maybe they've got a language in there called an accelerated death benefit rider, where depending on what your health circumstances are, perhaps you might be able to get some of that death benefit prepaid to you on a tax-free basis. So pull out your insurance contracts that you've got and make sure that you've got a good understanding of when all those fit together. For my last slide, everybody, is think of organizing all of your priorities from where you sit right now at the beginning of 2020 with whatever your caregiving circumstance is. And how I built this graph, a lot of times parts of the puzzle that we were most hopeful for, before a period of care, sometimes those aren't appropriate to consider moving forward. After a healthcare event, there's a new puzzle that sometimes needs to be put together. Think of the new priorities around health outcomes that we're most hopeful for. What kind of steps can be taken to protect ourselves against circumstances that we're most afraid of? I think that the idea of being able to effectively identify and write down and organize these new priorities puts families in a better position to be able to make choices to align their finances to pay for this out of pocket. And I'm going to be able to take questions for our time remaining, but before I do, just going back to that question before where the audience member was asking about Medicaid planning, I think going through a process like this first, before you jump into Medicaid planning, where you might have to make irrevocable decisions before measuring your family's ability to pay for care first, sometimes it's like ready, fire, aim. I think that taking a sober look at what your new priorities are and what the best case scenario is and what you can do for yourself, that should be your first step. So I'm glad at the timing of that question. So Juliana, with that sort of concludes my prepared presentation. Let me stop there with a little bit more than 10 minutes remaining, and I'd be happy to field questions that come up from this point. Thank you. Juliana, is your mic on?
Can you hear me?
I can hear you right now. Perfect timing.
Oh, sorry about that. I thought I was talking and I didn't realize you were not listening to me. Sorry about that. So one of the questions that one of the participants asked was, could you address the long-term care insurance, in particular the life insurance policies that promise to cover long-term care expenses and pay your beneficiaries if you don't use long-term care benefits?
Oh, great question. Thank you. So I'll address that three ways. The first one is an acknowledgement that a lot of the retail long-term care insurance that people were purchasing when I started my career back in the early 90s, where those think of like the federal government plan, those policies are having a whole lot of trouble maintaining their premiums. If you think of long-term care insurance and you read about these premium increases, a lot of times those were contracts where they were only paying benefits out of a pool of money that would only be reimbursable for long-term care expenses. And those policies, generally speaking, I recommend almost all the time, keep them, don't replace them. Think about paying the higher premiums, even though that nobody wants to do that. And that leads to the lady or gentleman's question about these hybrid policies, the life and the long-term care. New contracts have come on the market in an effort to try to avoid some of the problems of the traditional long-term care insurance model. And what they end up doing is exactly like you said, Juliana, is listen, you can buy this policy for yourself or for you and a spouse, and it'll either pay benefits if you need long-term care, and if you don't need long-term care, then the death benefit can go to children. I like that idea to a point. Right? There's the first circumstance is these are really expensive contracts. So if you're taking a look at sort of a broad brush of different seniors in Fairfax County, there's a pretty heavy percentage of families that wouldn't be able to afford these kind of contracts. I have worked with and had my hands on policies that we've recommended where premiums are upwards of $10,000 or more annually, where deposit amounts can be way into six figures, $100,000 or more. So I like the concept because what people are buying is the predictability of I don't have to use it or lose it, but it isn't a product that you can go into and expect accessible premiums to a large group of people. The other thing that I would mention about these policies, remember that you're primarily paying for the death benefit. You're primarily buying a life insurance policy that's going to be giving benefits after you pass away. And imagine the way that the policies are built is the insurance companies have figured out what is the additional cost that we need to add on to this life insurance chassis to give families the option of having some of this money available to them earlier. So remember that overwhelmingly the cost of this is the death benefit. And for consumers that want to think soberly about this is, if do my beneficiaries need this extra death benefit as one of the factors of whether or not that's the appropriate purchase? I like the policies if they make life more simple for families, but I am very aware of the cost sensitivity. I would go back to where I started, which is that might be the plan to pay for the things that you're most hopeful for, or you're most fearful of. But you also, before you write a big check on one of these hybrid policies, certainly measure your own ability to pay for the care in the best way possible, just to know if you need it. Because a lot of families that can afford this might be able to come up with a financing strategy out of pocket discrete from the insurance recommendation. Great question. Thank you.
Also, I have another question from the audience. As a caregiver, can I deduct money I have spent on my loved one's behalf for long-term care?
Can you deduct money that you've spent on your spouse's long-term care? Yes, there is.
Or if it's not a spouse, let's say a parent or a mother, father.
Okay, so there's a little different. There's some differences. So generally speaking, where the deduction comes from is it's basically on the individual's tax return. if a child is spending money on a parent, then the only way those expenses are deductible is if the parent qualifies to be a dependent of the child. And that sometimes is a challenge. There's some income requirements that you got to be earning a certain amount or less to be considered a dependent on somebody else's return. If it's on the husband or wife, if it's a single household, the senior household, generally speaking, there is you're able to deduct a lot of that. What I'm going to do is make a quick reference to if you go to irs.gov and you type in medical expense deduction, it'll pull up a paper. I think it's 740. I might get the number wrong, but if you type in irs.gov and medical expense deductions, you're going to look right there. And what they have on that publication is a listing of all of the different expenses that are deductible. And I would refer right to that IRS document for some guidelines.
Okay, thank you. And I have one last question. So sometimes this topic can be very sensitive to address it with family members. So what suggestions do you have to kind of bring this topic up before, a crisis is going to hit the family? And at what moment do you think we should start planning for long-term care?
Well, I'm glad you asked that question. I think that the main way to answer that question, Juliana, is I think that we need to anticipate that as retirees, we're going to be spending money on long-term care expenses as a baseline. I don't know that it's so much a time. I think it's a standard. I think that families need to accept the reality that Medicare and Medicaid are probably not going to be expanding. They're not going to be, covering more long-term care costs than what they are right now. So that's going to put more of an impetus on all of us to have to make decisions right now about these plans. I think that it should be standard with all retirement planning that you build out some estimates of paying out of pocket as part of your baseline. Remember the slide that I had before, this one, that talks a little bit about having to sometimes repurpose or walk away from some priorities because of this new healthcare event. I think that you should anticipate, all of us should anticipate a healthcare event as really a near certainty or an overwhelming probability, because that way it doesn't feel like there's as many trade-offs when people have to walk away for goals that might be important to them. So the best answer is, I think before retirement is the best time to start paying attention and accounting for it. But certainly through retirement, I think that should be a baseline. Certainly, a healthy 50, 60% of families in Fairfax County, I'm sure nationally, they think of it kind of for the first time at a change in health. Remember the slide that I gave you about options taken away? You want to make all of your plans and establish your priorities before options are taken away.
Thank you, Tom. And I don't know, I think we may have time for another question. What do you think?
I'm ready if you are.
Okay, so one of the attendees is asking, long-term care insurance, is it for nursing care only, or does it fit into dementia nursing care?
Oh, thank you for the question. And I think we'll be able to get the answer in. Long-term care insurance, generally speaking, is not for nursing home only, at least in terms of what is on the market for purchase right now. It will typically cover home care, assisted living, adult daycare, et cetera. And typically the benefits pay if, again, somebody needs help with activities of daily living or if they have a cognitive impairment. But it pretty much is setting neutral. So wherever it's most appropriate for somebody to receive care, typically the insurance is able to offer benefits for that.
Okay, well, thank you so much for your presentation. And before we end, I actually would like to remind our attendees, if you have any last minute questions, we still have a minute, so please go ahead and write it down. We are getting ready to wrap up, so as you signed out, there will be a brief survey. Please take a moment to answer those questions and help us provide topics that you're interested in. We do have 9 more webinars scheduled for this year. Nutrition Needs in Older Adult, special considerations for caregivers coming up on Wednesday, March 11th, so stay tuned. Tom, thank you so much. The information that you provided today was really very insightful, and I really like the way how you approach such a sensitive topic. And I also want to thank you for giving us your time and your expertise. And if anybody wants to contact you, is the information on your slide available or?
That's right. So you can find me at, we're in Tyson's Corner, the website, www.affordlifecare.com, phone number 703-936-0848. I'm happy to answer any questions coming off of this. Certainly mentioned that you had an opportunity to see us through this Fairfax County webinar, and happy to be able to point anybody in the right direction. Thanks very much for hosting me.
Thank you. Take care.
Bye-bye.
Bye.